everyone. My name's Anna. I'm a student member of the Brighton Medico Society, and I'm joined by fellow member Gabby this evening. Thank you very much for everyone joining us live tonight, and for everyone accessing this as a recorded session from the Medico website. Tonight is our second event in the Medico student-led series, featuring talks by Professor Christopher Liu on workplace adjustments to reduce person-to-person transmission of SARS-CoV-2, and Dr. Julian Tang with an update on the coronavirus SARS-CoV-2 aerosol mutation and vaccines. We will be taking questions at the end, but we've also got a chat in Zoom, so please feel free to leave your messages there, send them through, and we will get to them at the end. And I will just start by introducing Professor Christopher Liu, who is the Medico president this year. He's had an extended rule thanks to the pandemic, and he's a consultant ophthalmologist at the Sussex Eye Hospital and an honorary clinical professor at BSMS, and he also has an OBE. So I hand over to him.
Well, good evening, everybody, and thank you for coming to the second student-led pandemic webinar. We were hoping for this to be hybrid, but of course, with the national lockdown, we're actually broadcasting from an empty room. My brief today is to tell you briefly about workplace adjustments to reduce person-to-person spread of SARS-CoV-2. And then Julian will tell you, as a virologist, more about the virus. So I have no financial interests, but I do some private practice, and I will be mentioning that within the slides. And a big thank you to Victor Leung, who's an industrial hygienist, and Hassan Naveed for their helpful suggestions when they reviewed my slides. COVID has been with us for over a year now, and it was first noticed by whistleblower ophthalmologist Dr. Wen Liang, who unfortunately passed away with COVID. And you know how we are at the moment in the UK and in the world. We have over 80 million cases in the world, and I'm sure we're going to reach 2 million deaths in due course. And when I've last looked on the 27th of December, in the UK, we had 2.3 million of cases and over 70,000 deaths. And you know that we're reaching 1,000 deaths per day at the moment. So the routes of spread, we have fomites. So if we cough onto our hands and touch something else, or we cough directly onto a work surface, and you got lift buttons and doorknobs, then somebody else touches those fomites and then touch their face or nose or eyes, then it may be transmitted to another person. Then we have droplets and aerosol, and there is no distinct cutoff point between the two, but aerosol is very fine and stay on the air for in the air for much longer. So the virus shedding is from asymptomatic infection, and there are cases when they're infected but they have no symptoms, or it could be shed during the pre-symptomatic phase before they become symptomatic. And of course, when patients or citizens are symptomatic and they cough, then of course much more droplets and aerosol come through. And then in the post-symptomatic phases, people may also be shedding a virus. So as we all know, the symptoms are temperature, a new, dry, continuous cough, a loss or change of sense of smell or taste, and a skin rash. So you've seen this coronavirus thousands of times on television, and here's an urticarial-like rash which can appear in the body. And here are COVID toes, which look a bit like a chilblain. So after a week, you start recovering or you get worse. And if you're unlucky, you get worse. and you can become oxygen desaturated. And if you're very unlucky, you get organ failure and you may die. And you may recover and have long COVID as well. And it is not clear as to who might get mild disease and who might get severe disease. The initial response in the UK was a cessation of elective outpatient and surgical activity. And here you see a picture of Hassan Naveed on the right here. Preparations for redeployment. So the young, healthy junior doctors, they are more effective because they still remember the general medical training, and they're closer, they're just come off medical school. So they have, some of them have been redeployed, and it was like going to war, and we did not know much about the virus at that time. And the older, more fully differentiated doctors who are not useful in acute medical wards or ITU, they stay put in the usual place of employment. There was actually great confusion to begin with regards to the use of PPE. And in fact, I mean, some of us were told off wearing masks in the initial stages. And of course, there was a national shortage to begin with, but thankfully, we have much better supply of PPE now. So the profession and the government learned as we went along, and COVID assessment for staff in the hospitals came late. And now we know that the older you are, the more susceptible you are. And if you're male and you're more susceptible, and if you have colored skin, then you're more susceptible, or if you're overweight and other comorbidities as well. So basically, the vulnerability is in the mucous membrane, thus the need to protect your nose, mouth, and eyes where your mucous membranes are. And remember that mask wearing is predominantly for protection of others. So you're reducing droplets and aerosol through direct spread, contamination of surfaces, and filling the air with aerosol particles. And it is finally accepted that everybody must wear a surgical mask in the hospital environment, but it took several months before this came into rule. And here we have a publication which tells you about why it's important for everybody to wear a mask, and also specific designs when it comes to multi-layered fabric mask, how to make them more effective and acceptable. So also basically, we have to remember the other sort of mask called respirators, FFP3 or N95. And here we have an example. I don't know whether you see it. And I must just change that for effect. I put that on. And you see here, this is an N95. And for this to work, you need a formal fit testing. And every time before or used in a high-risk area, you check that it is actually tight fitting, and you shouldn't really smell anything. And you're always supposed to use the same make, model, and size. Otherwise, it doesn't work. And men must be clean-shaven, as if you have a beard, it would break the seal, and it wouldn't be effective. So remember, this is predominantly for protection of self, and even with this, you still need to carry on with strict hand hygiene and no touching of face, because that's where the virus can enter your mucous membrane. And remember, surface decontamination in your work area as well by wiping surfaces down. So in the hospital, how do we keep the workplace safe? And I think this can be generalized to offices as well. So basically, anybody who's not well should be self-isolating. And in hospitals nowadays, we test ourselves twice a week with lateral flow tests. So here you have an example, one of my tests, and this shows that it's a good test, good quality test, and I'm negative. The sensitivity is not great, it's only about 60, maximum 70%, but with regular testing, it's still much better than not testing at all. So we have public education as well. And so when patients, when they enter, we check on the history, whether they have any symptoms, have had any symptoms. Temperature checking, we've actually given up on this because when you come in from the cold, you have a very cold skin temperature. So even if you have a slight fever, it may not be so noticeable. Okay, so we also limit the number of people in the building at any one time. And you can see we also say some of the seats you should not be sitting on, so you keep the social distancing. Now, particularly in the ophthalmology clinic, what we've been doing is we keep examination to minimum. And here you see that we have a breath guard to keep a kind of a separation between the examiner and the patient. So can you all see that this is actually a photograph from America, and we have a few things which are not right here. So normally now the patient would be masked and the examiner would be masked. And also we have, in this country, we have bare below elbow and no jewelry and no watches. Now, in some places, we ask patients to wait in their cars. And if they don't have a car, then they just still wait outside. And here is a quartz heater, which is very useful because the heat cannot be blown away. It's heat directly applied on the patient's clothes and body. And here you see a paper from Moorfields, from colleagues from Moorfields, to use software. It's called Attend Anywhere, that you do all the talking and the explanation after the examination remotely. So the face-to-face time is much reduced, and there's very little talking when the examination actually takes place. So that's mutual protection to both staff and patients. In terms of surgical procedures, we ask patients to self-isolate as far as possible, so they are less likely to have COVID, and we test them for COVID as well, up to 2 or 3 days beforehand. But that's not foolproof. So for example, yesterday I operated on a patient whose Monday COVID test was negative. And then just now I heard that the Tuesday test, which they do in the care home on a regular basis, has come back verbally as being positive. Luckily, all the staff were protected with PPE, and so we don't need to self-isolate. So aerosol generating procedures, people have been worried about intubation and extubation. And you can see here that during ventilation, manual ventilation, and intubation, then you can have aerosol coming through. However, thankfully, with a recent study, it has shown that there is not that many particles coming through. High-speed drilling within the operating theaters can also produce aerosol, and so can cataract and vitrectomy. However, there isn't really that much virus in the eye, so it's not so bad. And with ophthalmic surgery, there is now much widespread acceptance of operating on both cataracts in both eyes at the same sitting for increased efficiency, and also so patients do not need to come back twice to hospitals. And of course, hospitals are potentially dangerous places. Now, just a note on mask wearing. So here we have a surgical mask. I'm going to go back to that so I don't get too hypoxic. So, you know, when you wear a surgical mask, your glass can steam up. So what you can do is to put some tape. And also, if you use a high quality mask, then there is a metal strip inside here which you can bend to conform to your nasal bridge, and that gives less steaming as well. So what we've done is we noticed that during surgery, breath can be misdirected or directed from the nose directly to the eyes. I'm talking about ophthalmic surgery now. So we've adopted the technique of the patient not wearing a mask when they're having eye surgery. And also immediately afterwards as well, before the wound is well healed, we worry that the misdirected breath can also infect the eye. So we have to be careful with that. So it's also, the pandemic has also affected training, and students and trainees have suffered from reduced face-to-face interactions and bedside teaching. And junior doctors have also suffered from redeployment and loss of surgical operating, face-to-face teaching, grand rounds, and professional exams. Some of them have also been cancelled or postponed. So there is some loss of confidence, especially after the first lockdown. And we all know that everybody's mental well-being is not in a tip-top form. So it is important that we support one another and support our trainees. And we all know that as now we're doing a Zoom meeting, but it really is not as good as face-to-face teaching. But it does allow speakers to come from far afield. So if you're interested in what we can do to help with improve teaching in the pandemic and how we can do virtual reality conferences, here are two papers that we prepared previously. So aerosol, which we will be concentrating on from this point onwards, this remains ill understood. Basically, aerosol are fine particles which are airborne. They do settle, but they're slow settling, and it could take hours. And it's like the scent of perfume. It can travel far and wide, especially with prevailing wind or current, which can be man-made. So you can have very well-meaning ventilation, but if you're sitting in a restaurant and upstream from you, there's a table with infected people, and the ventilation blows from that direction to your table, then your whole table can be infected. So ventilation is important, but it has to be designed properly. Now, droplets, which are larger particles, can evaporate and become aerosol and become airborne. And aerosol is produced by talking, shouting, singing, coughing, and sneezing. So here's a link. I don't know whether it will work to show you what it looks like. Now, obviously, it's less of a problem outdoors because you've got lots more space. Okay, here's a video. No? Not working.
Now I'm recording.
Stay healthy.
Great,
Stay healthy.
great. Less loud.
Stay healthy.
Do-
Are you recording?
Yeah.
Stay healthy.
Louder,
Stay healthy.
louder.
Stay healthy.
Nothing.
Well, there is a report that you can't actually see this on the screen, so I apologize for that. But basically, the aerosol is mostly stopped when you wear a mask. So I was just saying that it's less of a problem outdoors, but cyclists and runners can leave a long trail of aerosol behind them. Now, it's important to open windows when you're indoor in a confined space. And really, mandatory mask wearing is important whenever you're indoors. And I find it quite surprising that some schools actually stop their students wearing masks in classrooms. And here we have a publication which tells you about the conundrums of source control because of lack of understanding of aerosol. So we was talking about ventilation. There are some general rules and types of ventilation. So these are the three types: general air scrubbers and local exhaust ventilation. With general ventilation, this is important for air change, but the flow direction and pattern are also important. So take, for example, here that we have somebody working on a dust-producing procedure. Okay, this is a factory, for example, and you've got a fan coming through and pushing air through, and an exhaust fan here. So that's fine. However, look at this. If you reverse that, and the air comes in here and blows the dust onto the worker's face, then that's no good. Now, air scrubbers. So here's an example of a Daikin air scrubber. Basically, where there are no windows or opening windows are not practicable, where there is no dilution ventilation, or where the dilution ventilation is hazardous, these machines take air in, clean it through a HEPA filter, and then recirculate it. So this can be a replacement for ventilation, and you need to calculate the room area and the ceiling height to make sure that it is a sufficient air scrubbing capability. And in a larger room, you may need 2 or 3 of these machines. Local exhaust ventilation. So the suction here, we would place close to the patient's masked face. And remember, it needs to be quite close because there is 19% suction loss if it's 1 duct's diameter further away from the patient's masked face. So basically, the air here is sucked in, and then this whole thing, the blue thing, is a filter, a HEPA filter, and that needs to be replaced every few months. So then the air comes out here cleaned up, and the virus particles are removed. And applications include dental surgery, and emerging applications include ophthalmic slit lamp examination, Humphrey's visual field examination, and minor procedures on the eye and face. So here's a diagram of the whole thing. And here is a Humphrey's visual field machine, which is used for glaucoma testing. And you can see that this ducting of arm, we put this just next to the patient's head and suck away the breath as they breathe. Vaccination, we'll hear all about it, but my understanding is that vaccination provides protection to the person who's been vaccinated, but they can still be infected with less symptoms, but they can still spread the infection. So mask wearing will be for quite some time yet. So thank you for your attention. And if you want to have a copy of these slides, then please email me. Thank you.